Senior Shield is basically a comprehensive health program that covers medical, surgical, dental, physiotherapy, pharmacy, diagnostics labs for our senior citizens, 70 years and older, who are belongers of Anguilla. We know that we have seniors who sometimes sacrifice their health because they're concerned of if they can afford it. And we want to make sure that those seniors can afford health care here in Anguilla. And so at the public clinics and hospital, they can access these services if they're 70 years and older, starting on the 1st of May 2023. One of the things I realized when I came back and started my ear, nose, and throat surgery practice in Anguilla in 2010, I realized that there were seniors who needed that service. Anguilla has a lot of head and neck problems, sinusitis, ear problems, tonsil, throat pain, other issues. And a lot of the senior patients, when they came, they're not working. And it was hard to have to charge them, with suddenly you can't run a practice, free. There are expenses, but it was difficult to charge them the consultation fees when they explained that they couldn't afford the services. And so it dawned on me that in the United States of America, where I spent many years in practice, that it wouldn't be a consideration because persons who were 65 years and older would have Medicare or Medicaid or both, and they were not concerned about whether they could afford health care. And I think that gave them an upper hand on us here in Anguilla, because if you have to be concerned whether you can afford your medication or go to the doctor versus being able to feed yourself, take care of your bills, and then I think that caused us to be at a disadvantage for our people here in Anguilla.
The Senior Shield program, it is very good. Old people really shouldn't have to pay for health care, and neither should children. So I'm looking forward to seeing it extended to the children. And at the same time, I'm wondering how sustainable this program will be. But right now, for the elderly, it's working fine. I appreciate the help the older people are getting. That's through the senior care program.
One of the things I also realized is that these persons would have contributed significantly to Anguilla's progress. They were involved in the revolution of 1967 to 69. They would have been there for us as we were growing up, our generation, and whether they were teachers or they served in other capacities. And some of them our parents and grandparents. And that was a concern to me, that we should be able as a country to provide this service to our seniors.
Senior Shield is good for like 70 years, and me too antiques. It's a very good idea. I hope it be around for a very, very long time. I went to the doctor, I had to pay nothing. My physical test is nothing. All I had to do is show my car, BRAM, and that was action.
Senior Shield is not working for me at the moment right now, but it may be good for somebody else. The hospital might not have all my medicine and what's not, but I hope by some time they would have the medicine what the French pharmacy got.
Those 70 years and older would be able to go to the doctor, go to the hospital, and go to the clinics if they need help, be able to afford their medications, do their labs, and the diagnostics such as x-rays, CT scans, and now that we have an MRI scanner, that they'll be able to access that service. Very important, because I've had persons come up to me and said that their labs are costing them $800, $1,000 to do. Now, if you think about it, that this is covered, and that's $800 to $1,000 that they don't have to spend on their health care, and they can use that for other purposes.
I am Brenda from Brenda's Tender Loving Care, nursing home for seniors and juveniles. The senior Shield program, I find it working is very beneficial. It's working, we've had a few hospitalized, and as far as I know, they haven't gotten a bill, so that is a plus for the families. I've been able to get medical supplies from the hospital, no charge to the families or to the home. So yes, it is working.
What I see is that as persons can access the healthcare system much easier, then that should improve their healthcare. They can afford the medications, and they can afford the diagnostic services. And also now, I think it helps their family members and their children or grandchildren who were actually paying for these services for them before. Now they'll be able to keep that money in their pockets. And I think what I envision is a healthier elderly population, and then that will transfer down to our younger persons, because I think that we'll be able to get access to healthcare faster and also earlier, because we know the longer we wait to access the healthcare system, there's more risk of morbidity and mortality.
Well, hello. My name is Orlin Reed. What is the definition of SHIELD? My definition is it's a protection. Therefore, I look at the senior seal that has been established here by this government as something that protects our people. But you know what is so curious? It protects the elderly, but it protects me also. I've been paying for medications for my mom, x-rays, all those things, and the money just keeps piling up. But right now, with Senior Shield, zero. That money I can take and do something else. So Senior Shield, I am 58. I soon will be 70, and I will benefit from Senior Shield. You can too.
Senior Shield, I mean, the term itself talks about protection and prevention, you know, and I would admonish those who are eligible, 70 years and older, or those who are, you know, 69 and getting to 70, get prepared for this. Go out and register. And registration for those 70 years and older, if you can't get there yourself, have someone, a family member, a community worker, go out and register so that you can have access to the service, so that if you have to go to the clinic, you're already registered. It makes it easier. If you go to the hospital, whether it's emergency or it's to access the diagnostics, labs, x-rays, then you're already registered. It makes it much easier to get taken care of and get into the system. Now, I must say that you know, we have to be grateful that this is provided, because this is being paid for by the people of Anguilla. These services, you know, we contribute in terms of taxes and fees, and this is a program that is being paid for directly, you know, out of taxes that are paid into the consolidated fund. So, you know, access this service which is being provided for you by the government and people of Anguilla.